Welcome to today's Health Talk with Dr. Jelen Israel Civic of Premier MD Care. Today we're going to be talking about how to stay healthy during flu season. So, Dr. Civic, who should be immunized for the flu?
Well, the CDC says that everybody should be immunized from the age 6 months and up, and especially the higher risk individuals, which are the people that are over 65 years of age, people that live in nursing homes or assisted living facilities, and children that go to daycare, and people with chronic illnesses like asthma or chronic lung disease. Those are the higher risk individuals, so we really, age 6 months and up, everyone should be immunized.
Got that. So I've been reading a lot about the high-dose flu shot, which is a more recent development. Who really needs to be using the high-dose flu shot?
So the high-dose flu vaccine was really created to help immunize the people that are over 65 years of age, because as we get older, our immune systems become weaker. And so the vaccine, like it says, it's high dose, so it has 4 times the amount of antigen, which is the part of the flu virus that your body will develop an antibody or develop a resistance to or protection against. And so we give them higher doses so that their body has a better chance of developing immunity and hopefully preventing them from getting the flu if they were to be exposed to it.
I got that. All right, that's important. So one of the things that it can be confusing is how can you tell if you're getting the flu or if it's just a cold?
Right. Well, sometimes that is a little bit confusing. Typically with the cold, however, well, first of all, the two disease processes, there are 2 different viruses that are involved. And the common cold is typically more of a gradual onset where you feel a little bit achy, sneezing, maybe a low-grade fever, but not a high-grade fever or headache. The symptoms are milder. With the flu, it's more of a very sudden onset, sudden headache, high fever, chills, body aches, and sometimes you can have a cough, but you're not bringing up any sputum when you cough. And so that's kind of what helps us differentiate between the 2 symptoms, 2 diseases.
And exactly how is the flu virus spread? I mean, I kind of know that when people sneeze, I better stay away from that. Right. But are there other sort of ways that it's spread and ways to kind of prevent it as much as possible?
Absolutely. So person to person is how it's spread, and it's through respiratory droplets. So if somebody sneezes, coughs, or even talks, if a little bit of saliva were to travel, and it can be as far as 6 feet away, and if you're exposed to it and it's on your hand and you put it in your mouth, you're going to get it. Sometimes you can pick it up from surfaces of computers and laptops and phones, but not as often as through direct respiratory contact, person to person.
Well, how long does that virus last then? Like when you say you might be able to pick it up from a computer or a phone or something like that, does the flu virus last like an hour or a much longer time period?
It would have to be within a few minutes, almost spontaneously at that time. And typically with the flu also, the virus actually can be in your body and you might not even have symptoms. This is the other thing. You might not have symptoms for a day or 2, but you could be transmitting that virus to other people and not even know it. But typically you are at your highest rate for infecting other people. If you have had symptoms by day 3 or 4, you are still at risk for spreading it to other people.
Okay, got it. Now, we always talk about it like flu season. So when is flu season and when does it actually peak?
So the flu virus or the influenza virus is here year-round. But the reason we call it flu season is because we see a lot more cases of it between October and April or May. And the peak season is really December and February. That's when we see the most people going to the doctors to get treated or people getting admitted to the hospital because of complications from the flu.
So when should I get vaccinated for it then?
So the best time would be the end of September, early October, because it does take about 7 to 10 days to develop immunity once you get the vaccine. So you don't want to assume that you can get the vaccine and then get on a plane the next day and that you'll be protected. So plan for it in advance and make sure to get your vaccine when it's available, whether it's at your doctor's office or at the pharmacy. And if you're over 65, please make sure to ask for the high-dose flu vaccine.
It's not too late to get it now then, is it?
No, it's not too late, but you've kind of lost your window, a little bit of opportunity. But if you haven't gotten it yet, we still haven't hit high numbers of people getting the flu. So go ahead and get it now.
Got that. And ultimately, what do I do if I get sick with the flu? Because I have to admit, I'm one of those people that kind of toughs it out at home with a big box of tissues. But I think there probably is better ways to deal with that, right?
Right. Well, for some of us, we don't have downtime. We can't afford to be sick and away from work. But if you're younger, your body typically can fight it. But, really you should seek help within 48 hours because it's important to be tested. If your doctor does have a test that we can do in the office, those tests aren't perfect. So a lot of times we go by symptoms. But if you do test positive or if your symptoms look very consistent with the flu illness, then you can be treated with an antiviral medication, which does not cure the flu. All it does is basically shorten the duration and the severity of the illness. So you get over and you get healthier quicker.
And I would have to assume that it's more important for those people who are really at risk, like those high dose flu people, to get, if they do get it, to definitely come in and see you. And
Absolutely.
Yeah.
Yeah, because the other things that can happen if the flu isn't treated right away is you can develop pneumonia and become seriously ill and end up in the ICU. And that's typically we see with the older population.
Okay, got that. Well, thank you very much, Dr. Civic. And thank you for joining us at Premier MD Care for today's Health Talk. We wish you safe and happy holidays, and we'll see you again in the new year.